Shock. Few facts about shock. Shock has many meanings in common usage. Most often, it refers to a sudden mental or emotional experience ranging from a trivial unpleasant surprise to the deep disturbance of personal disaster or bereavement. Whereas in clinical setting, this term will be used for a potentially dangerous condition with quite specific physical features. In medical terms, shock occurs when the blood supply to the tissue is inadequate to meet the requirements of the body. It is a sudden or acute failure of the circulation. Definition: shock is a depressed condition of many body functions due to the failure of enough blood to circulate throughout the body following serious injury. Shock occurs when the heart is damaged. Causes: basic cause. First one is pump failure. It occurs when heart is damaged as heart attack or trauma to the heart. Hypovolemia. Blood or fluid loss from blood vessels decreases blood volume, usually a result of bleeding, and results in inadequate perfusion. Causes: trauma to the vessels or tissues, fluid loss from GI tract, plasma loss through burns, decreased body fluids, diabetes insipidus, and diuresis. Relative hypovolemia. The blood vessels can dilate enough that the blood within them, even though it is of normal value, is inadequate to fill the system and provide efficient perfusion. Causes: infection, drug overdose, especially narcotics, and spinal cord injury. Other causes: severe bleeding, crush injury, infection. Heart attack, perforation, anaphylaxis. Shell, bomb or bullet wound, rupture of tubal pregnancies, starvation and diseases. Factors contributing to shock: pain, rough handling, improper transfer of the casualty, continuous bleeding, exposure to extreme cold or excessive heat, and fatigue. Dangers: organ failure predisposes body to infection, leads to loss of body part, it may lead to death. Sign and symptoms: altered consciousness, restlessness or irritability, pain or bluish color, moist skin, excessive thirst, rapid and weak pulse, rapid breathing, nausea and or vomiting. In early stage, face pale or cyanotic in color, skin cold and clammy, breathing irregular, pulse rapid and weak, nausea and vomiting, weakness, thirsty. In late stage, apathetic or relatively unresponsive, eyes will be sunken with vacant expression, pupils are dilated, blood vessels may be congested, producing mottled appearance, blood pressure level decreases, unconsciousness may occur, body temperature falls. Different sizes of pupil, there is a comparison, go through it. First aid. Objectives: to improve circulation of the blood, to ensure an adequate supply of oxygen, to maintain normal body temperature. First aid. Warmth. W stands for warmth, A for air, R for rest, M for mental rest, T for treatment, and H for help. Proper position. Keep the victim lying down flat. Elevate the lower part of the body a foot or so if injury is severe, that is from 8 to 12 inches high. Place the victim who is having difficulty in breathing on his back with his head and shoulder raised. Carefully raise casualty's leg and support them with pillows, chair, pile of books or padded cushion. Shock position. If shock is due to head injury, Apply pressure on the injury and keep the victim lying flat. Do not elevate head or lower extremities. When the color of face returns to normal, elevate head and shoulder and continue giving care to the injury. In case of chest injury, raise the head and shoulders slightly. In case of nausea and vomiting or unconsciousness, keep the victim laying on one side, known as recovery, coma, or lateral position, preferably opposite from his injury except for sucking wound and stroke. Proper body heat or warmth. Maintain body temperature and victim must not be neither perspiring nor chilling. If weather is warm, the victim need not to be covered. If victim is cold, in spite of weather, a blanket may be placed underneath him and cover the body. Remember, do not apply any other direct source of heat. To make breathing easier, loosen any fastening or tight clothing around casualty's neck, chest or waist. Keep reassuring the casualty. Encourage them to talk or answer questions. This will help you assess their condition. Keep monitoring the pulse. If casualty loses consciousness, assess their condition. Be prepared to resuscitate. If breathing, place them in recovery position. Proper transfer. Proper handling of patient would prevent further injury to the patient. Refer proper techniques on transfer method on patient handling. Do not give anything by mouth, including water. If medical care is delayed and patient is complaining of intense thirst, you may wet his or her lips. Summary. Go through summary for cardiogenic shock. Next is the summary of anaphylactic shock. Go through summary of neurogenic shock. Go through summary of psychogenic shock. Go through summary of hypovolemic shock. Go through summary of metabolic shock. Go through summary of septic shock. Frequently asked questions. Do we always need to elevate the foot of victim in case shock is suspected? No. In case of head, chest and spinal injury, foot of victim should not be elevated. Do we always need to resuscitate the victim if shock is suspected? No. Resuscitation is required only in the case where victim is not breathing and there is no pulse. Is it recommended to give fluids to the victim in case of shock due to vomiting and diarrhea? No. If a person is in shock, don't give anything to eat or drink. However, you may wet the lips of victim if there is delay in arrival of medical aid. Can we use source of direct heat to maintain body temperature of victim? No. Never use direct heating as hot water bottle or heating pads to make victim warm, as it may cause burn injury.